Okay.
Okay.
Thank you. Y'all mail me one.
Okay. There you go.
I'm excited.
Is that too close?
Is it on?
Uh-huh.
Oh.
You like it? Mm-hmm. I like it.
Yeah. I don't know.
Hey there. We'll go ahead and get started. Louise turned on our Facebook Live, so thank you guys for being here. I've got information about the Alzheimer's Walk coming up next month, less than a month away, and then also information about our Senior Care Alliance Conference that's coming up as well. So really get online, use those QR codes to get that registered. And then I'm going to let a dear friend of mine that I've known for a long time, maybe 15 or so plus years. Her name is Wansley, and her therapy program is WM Health. She's a wonderful therapist in town, and she also used to be on the Senior Care Alliance board. She's the one that roped me in to become involved with this organization. So she's got lots of experience with seniors and their families and how to deal with some of those things. And she's going to be introducing our awesome speaker today that's going to be talking about falls. I'm going to adjust this camera a little bit more.
Thanks for prolonging my intro.
Okay. Well, it's
Too tall?
kind of different than it.
That's why I elevated it.
Wait just. Okay.
Put it in. Perfect. Great. We're trying to get right. Oh yeah, perfect. That's really nice.
Really nice.
Yeah.
Good.
All right, I'm Wansley. I am the owner and provider of WM Health and Wellness, LLC. It's a private mental health practice. I do all things basically seniors and caregivers, 25 and up, preferably up. I am here to introduce my lovely fiance. He is wonderful. He will be speaking to you all today. Let me get my bio out. Dr. Orosakwe is the founder and CEO of Crown Medical Services. He graduated from Ross University of Medicine and completed residency at UAMS West, Fort Smith, with the training in emergency medicine at Baptist Fort Smith. Dr. Orosakwe has been serving the River Valley for over 8 years. He enjoys gaming, Houston teams. Dr. Orosakwe is passionate about healthcare, education, mentoring, and community engagement. So next up is Dr. Orosakwe speaking to you on falling to elderly.
Whoa. Can you turn me down? It was okay. Okay. I'll fix it. Project my voice. I'm gonna be hoarse at the end of this, so you know. I'm not used to screaming. Let's see. Okay, so yeah. Thanks to my lovely fiance for that intro. Yeah, my name is Dr. Orosakwe. I'm an ER provider just about everywhere in the state. Mike, okay. Let's try it now. Check. Okay. Yes. Again, thanks to my fiance Wansley for the introduction. My name is Dr. Orosakwe. I'm an ER provider here in town, mostly in Van Buren, sometimes in Fort Smith, and just about everywhere else in the state. The Senior Care Alliance for having me speak. Happy to be here. Oh, and thanks to Scott on court. Thank you, Chef Jackson, for delicious food. You come here all the time. It's very, very good food. Okay. Let's get started. Hopefully, my stays. All right. So, what we're talking about is falls in the elderly. Obviously, this is a subject that's near and dear to all of us. This affects the population, a big population in our patients that come to the hospital that end up in long-term care facilities. And as our population gets older and older, we're going to have more and more elderly people. We're going to have more opportunities to have these falls. And so we're just going to do a bit of a deep dive into falls and how they affect us, how they affect our population. So I'm used to doing these talks to a medical community at a morbidity and mortality conference. So it's just important for me to disclose it. Well, to say that I have no disclosures, meaning I'm not part of any businesses. I'm not making any incentives to give this talk. I'm just trying to talk about a serious subject that deals with our population that we care about. Okay, so when it comes to falls in the elderly, the question is, why do we care? What makes it such a big deal? What makes it such a big public health issue? And one big answer is morbidity and mortality. Falls cause great morbidity, meaning people that can't get back to their baseline, they can't do their ADLs, they end up in nursing homes needing long-term care. So that's just a part of morbidity. And with the increased morbidity, you get increased mortality. More people die from these falls than you would think or imagine. Go get that story. More people are dying as a result of throwing that fall. And another important part about why we care about this subject is the fact that a great majority of these falls are preventable, either through physical conditions, polypharmacy, changing the medications that our elderly population is taking, possibly reducing the number of medications that they're on, and also environmental hazards, uneven surfaces, not using canes, not using walkers, these type of things. Okay, so some boring statistics. 27% of adults aged 65 or above fall at least once a year. That came from a 2020 study, and a majority of this population were women, Caucasian women, and Native American women as well. However, all populations within elderly are prone to really bad falls. About 50%. Check. Okay. About 50% of our elderly population in nursing homes have at least one fall. So that's a big proportion of our elderly population. 60% of those patients that have a fall are now that much more likely to have a subsequent fall, increasing morbidity, mortality. That's why we care. And about 62% of non-fatal injuries that have people end up in the ER are a result of falls in our elderly. So keep in mind as to why we care so much about falls in our elderly. So just definition of morbidity. Basically, morbidity is just getting away from your baseline, not being able to care for yourself, having major disabilities, not being able to walk, not being able to care for yourself, needing 24 hours supervision. So that all goes into the realm of morbidity. Another interesting thing about falls is about post-fall anxiety syndrome. Basically, when you have that fall, you become very, very anxious about falling again. That's important because when we get to a point where we're so afraid of falls, we don't get up and move around like we're supposed to, leading to lower extremity weakness, making you more prone to falls anyway. So definitely something to think about. This is associated with living alone, depression, and like I said, just being more prone to falls because you develop imbalances in strength and your gait. When it comes to morbidity, hip fractures are a major problem when it comes to falls. Some more statistics with this is we have quite a bit of hospitalizations because of hip fractures, and about 90% of these hip fractures occur from a preventable fall. Even in the ER, even in the ER, I've definitely seen a patient come in, had hip surgery from a fall, and then goes to their long-term facility, and then has another fall, breaks the other hip. So when it comes to these hip fractures, they increase all-cause mortality, meaning you're more likely to just die in general from anything else. That's just what this shows. So the fact that these falls occur from preventable causes is why it's become a big public health issue. Let's see. Mortality again. It's basically defined as being subject to death, which we'll get into. Head injuries are a big problem when it comes to falls. They result in concussions, not being able to get back to your baseline meditation and thinking. And then also brain bleeds, especially on our elderly patients that are on blood thinners for whatever cardiac reasons. Here's some more medical stuff. So what this is a cross section of it's a CT image of a brain bleed. So basically this is a subdural hemorrhage. Notice the conical shape. I guess for non-medical people, this is a CT image, and we call it cross-sectional. So imagine looking upwards at the brain, and you're slicing it in half, and that's what we're getting. That white part is all blood pushing on the structures of the brain, causing you to die. Another image. This is a subarachnoid hemorrhage. Pretty much the same thing. Let's see. Okay. So when we talk about these risk factors for falls, there's several. Obviously, being elderly and female is the biggest risk factor. But also, again, having fallen in the first place, you're 60% more likely to have another fall. And then also visual impairments. If you can't see the environment in front of you, you're more likely to fall. Cognitive impairments, those of our population have dementia, you get confused, run into things, trip, fall. And then orthostatic hypotension, basically that's a state which is usually caused from multiple medications, basically when you lose the ability to maintain your blood pressure and your heart rate, when you go from sitting to standing, you get dizzy, more likely to fall. And history stroke, that's a big risk factor as well. So, when it comes to evaluations, we're talking about how we can pinpoint this population of people that are more likely to have these falls. And so, again, when we see them in the clinic, we're asking if they've had history of falling in the first place. And then we just go into their past medical history to see if they're having any conditions that are making them more prone to fall. Vertigo, having a low blood pressure, having multiple medications that are making your blood pressure low. So all things that we look for when we're trying to evaluate our high-risk fall patients. And then we have these functional tests, which are good tools. The performance-oriented mobility assessment, the Get Up and Go, functional reach test. They're all tools that we use in clinic to kind of identify who might be at greater risk. The Get Up and Go is a simple test where we have them sit down in a chair with no arms, have them stand up, walk about 10 feet, turn around, come back to the chair, turn around, and sit. And basically, we rate it from a scale of 1 to 5, 5 being the greatest fall risk, and 1 being no fall risk. And so, so it's a good tool. The only problem with it is, it's kind of subjective. It's kind of hard to get a baseline, but a very good tool. With just identifying who's more prone to falling. The functional reach test, we don't use this a whole lot, but it does use some insight. Basically, you put a yardstick up on the wall at the level of the patient's shoulder, have them reach forward, and then seeing how far they can reach forward without falling. If you can reach about 6 inches, that's about normal. If you reach less than that, then you're at high risk for falls as well. Another one is the pommel, which is kind of like the Get Up and Go test. You're having someone get up from sitting, walking 15 feet, and walking back. This is a bit more nuanced because you've got a greater scale. 19 to 28 makes you, 25 to 28 makes you at a low risk for falls. Anything below 19 makes you high fall risk. Part of our physical exam, vital signs. So one thing we like to do is do orthotech vital signs, where you're taking vital signs where they're lying down, sitting up, and standing. If you get a big differential in either blood pressure or heart rate from lying down, sitting, and standing up, then that means they've lost their ability to regulate the blood pressure. That means you can stand up, get dizzy, fall, making you a higher fall risk. Visual acuity. We like to test visual acuity as well. Basically, we're testing whether they can see your environment around them. We test hearing as well. Again, that's part of your environmental sensory. If you can hear well, see well, you're at a less risk for falls. And also musculoskeletal test to see if there's any imbalances in muscle strength in the lower extremities. Some basic laboratory tests. Hemoglobin, basically we're looking to see if we're anemic or not. That can put you at increased risk. UN and creatinine is a kidney function test as well. Glucose, having a low glucose or a high glucose can make you dizzy, make you more prone to falling as well. Also, vitamin D is something that's routinely done at the primary care level. Some imaging that could be done that's focused on a fall risk could be an echocardiogram, which is basically an ultrasound of the heart where we see the heart function, to see if there's any problems in perfusing our brain, which makes us a whole lot more prone to falling if we're not getting that perfusion. Also, MRIs to look for strokes and anything intracranially to look out for falls. So, when it comes to prevention, it's basically looking at all these things we've mentioned. Medication, polypharmacy is a big deal. The more medication that you're on, the more likely you are to lose balance and have a fall. Physical therapy, identifying these patients and putting them into physical therapy to find out if they have any postural imbalances and things like that. We talked about orthostatic hypotension, and we talked about environmental hazards, basically uneven surfaces, not using canes, and all these things. Is that bring to the end? Any questions?
You said that females have a higher risk than males. Is that what you say live longer, or I'm just curious why that might be? Greater population of women, and greater population of women getting to elderly age. Yeah.
So as a ER physician, a lot of us like mental health or rehab, skilled nursing, there's a lot of us that want to help ER physicians out when you guys are trying to get these people placed. So do you have any good points, some things that we can take home with us to help you all move these patients faster, get them placed, get them help from falling?
So a lot of depending on insurance, a lot of the facilities will require a three-day inpatient stay, and if there isn't any reason to hospitalize, they typically have you do a home health assessment before getting placed into a long-term facility, either rehab or anything like that. However, I think some of the better insurance companies can have you have that evaluation in the ED and then transfer to those facilities. So I guess on the nursing home side, it's probably better to have that home health assessment or like physical therapy assessment in-house, or if there's any other medical problem that's going on, combined with it, that's where you send them to the ER, and we can hospitalize them, get them in a 3-night stay, and have them placed. Any other questions? All right, thank you.
I'm sorry, I'm late.
All right. Okay. We've got some events coming up. I apologize to y'all. I was late. I was trying to get some more community people involved. And so I'm excited to say that I had 25 people show up at the other event, and they are seniors 65 and over. So excited about that. Anyway, we have Assisted Living Week coming up September 8th. So we have the Alzheimer's Walk on September 21st. So you guys are all signed up, right? For that? Everybody's ready to go walk? Okay. And then the thing I'm most excited about, we have conference coming up. So conference is September 26th and 27th. So everybody got all your stuff together, everybody's registered, got your table set up, all of that good stuff. So that will be 8 to 4:30 both days, correct? Okay. So, and then our next coffee talk coming up is in Lavaca on October 8th. So lots of really good stuff coming up, and yes, ma'am?
It's going to be September 10th.
September 10th?
Yes, September 10th is our next one.
Oh, I'm sorry. And that is,
Like I said, September 10th at 10:30. Liz Martin is going to be talking about Jameson Bond and kind of giving them some information about that. So that's going to be really, really good. Called and confirmed that today. They're excited to have us there. Just a reminder to everybody, if you can come, it's a great opportunity to, of course, talk to the seniors, but it's standing upon our mission. Our mission is to help those seniors, to get them the information they need, get people in front of them that know what they're talking about. And so make sure that if you do participate and you want to come a few minutes early, bring your materials so that way we can give it out to them. These little people love the pamphlets, all the things they can read through and get education from. And also a reminder, if you do come, to bring a cheap, maybe run by the dollar store, get a couple candy bars, a couple little gifts that we can give out for door prizes.
they love door prizes.
And just like we do here, you'll get that opportunity to give up and talk about who you work for, get your information out, and it's usually a lot of fun.
September 10th?
Yes, at 10:30.
September 10th.
Mountainburg.
Mountainburg. Awesome. All right. Well, it looks like we had a great turnout here today. So thank you all for coming. And thank you guys for our speakers and for providing. This place is beautiful. It's gorgeous. All right. So are we ready for everybody just to come up and give your little elevator speech? Okay. All right. Well, I'll start and then we'll just go through. So I'm Candace with Home Helpers Home Care. And we do all of the activities of daily living: toileting, transferring, bathing, fixing, preparing meals, housekeeping, laundry, transportation. We are located in 7 states. I believe we have 56 locations. And my number is 479-316-4639. And who wants to go next? Everybody jump up. Go ahead.
All right, well, my name's Ashley, and I work with Mercy Rehab Hospital. We're a 50-bed hospital that's located off of Chad Colley. We do, just like how he was talking about that 3 midnight admission, you don't have to have 3 midnights for inpatient rehab. So that's an excellent thing to remember, that if patients are really needing that help, they can call us immediately and initiate that authorization and hopefully get them in the building. A good rule of thumb to know too is that inpatient rehab doesn't require physician referral. So have those spouses call. If you are out in a home, facility, clinic, wherever you are, grandma, grandpa, just have them call us, start asking questions, come out to our facility, let us show you around, and just let them know that this is temporary. Our goal is to get you stronger and get you home faster. My phone number is 479-957-1700. Once again, I'm with Mercy Rehab, and we would love to be able to network with you all and get to know you more. Thank you.
Hello, I'm Tanya Hagler with Elite Home Health. We provide skilled services in the home, a registered nurse, physical therapy, occupational therapy, speech therapy, licensed social worker. Like the doctor was saying, we do get lots of ER referrals for physical therapy evals. We do those, so please call us if you need anything, 479-494-7273.
Cindy Anderson, Business Development Director with Encompass Health. We are also inpatient hospital. We do not require 3 midnight stay either, and we do direct referrals, just like Ashley said. We do take referrals. Our goal is to get them through the door from the time we receive the call through the time we get to the door within 2 hours. That's kind of corporate standard. So when we receive a call, we are on it. We go out immediately, meet with that particular patient, family, and have those discussions on what will work in the program. We are also certified Joint Commission with the Center of Excellence in Ortho. So those falls that you're seeing in your clinics or in your business, your home health agency, definitely think we are the specialized inpatient home facility, or the inpatient facility where we do specialize in ortho. So we do have that Joint Commission behind us, as well as stroke and amputee. So we are here in Fort Smith, so 479-551-4770 is my phone number. Again, 479-551-4770.
Good afternoon, I'm Teresa. I'm from Van Buren Legacy Heights. We're an independent retirement facility, and what we do is all inclusive. We spoil the residents. What we say, they take care of themselves. We don't do the showering, dressing, and medication, but we do spoil them by cooking 3 meals a day, 7 days a week, and we do their laundry and their housekeeping. And we have 24-hour security, and all the utilities are included in the rent, and they can come and go as they please. It's just like renting an apartment in a senior community, a family community. And we have activities in the morning and the afternoon. And then we also have 3 certified special all-timer care units, and they're secured. And so if anybody has a loved one or knows of someone that is in need of that service, it's assisted living, 24-hour CNA, 24-hour nurse care, and they will just love it. It's like a family type atmosphere. And my number is 479-262-6466. Thank you.
I'm Brittany with Heart of Hospice. We do palliative and hospice care in our area. Our palliative providers meet the patients at their home, so one less specialist that they're getting out to go see. So if you have people with high fall risk, that's a good one. We can talk about some advanced care planning and goals of care. One thing I want to mention too is we're really trying to roll out a Brain Injury Alliance group, support group in our area. It is the 4th Monday right now of every month at 1 o'clock. And we had a couple come this month, and it was so fun to just be an open space for them. So this is for caregivers or survivors of people who are suffering from a brain injury. And it's hosted at Encompass. So if you know anybody, get with me. I can get the details, send out calendar invites, whatever they need. My number is 479-462-7932.
I'm April Cole with Area Agency on Aging. I'm the marketer as well as the Hospice Programs Volunteer Coordinator. We are available at 479-783-4500. We offer home health, we offer skilled nursing, we have a great hospice team, and all of this can be done in a facility or in the home. We cover the Fort Smith area, Crawford County, Mena, Waldron, Ozark, Casa Tot, all of those areas. We would love for you to give us a call if you need help with physical therapy, hospice, home health, any of that. We also have our elder victims of crime. If you have an elderly person that's been scammed out of their money, or if they're in an abusive situation, an unsafe situation, our EVOC team can help to get them out and get them to safety. They also have support groups for people over the age of 60 who have had romantic crimes or financial crimes, and they're having issues working through those emotions. In addition to that, we have a group that holds caregiver support groups. So people that are caring for their loved ones that need a place to go to kind of get guidance, and have people that are kind of going through the same journey in life that they're currently experiencing. That's a really great group to go to as well. And you can call our office or look on our website to get the different times, and follow us on Facebook. And then if you have people that could use any grants that are over the age of 60, we have grants that are available. We want to use them in all of our areas, especially our rural areas. We're not getting a lot of grant requests. Those grants can cover home modifications. They can help with prescription costs. They can also help, I've done diabetic shoes. It can help with the replacement denture, the adult briefs, anything like that that you're needing and doing without. We don't want that. A lot of times at this time of year, your electric bill is taking precedence over your prescriptions. We want to stop that and help settle your prescription costs if we can, and help make up the difference. So just give us a call. Thank you.
I'm Tiffany. I'm with Mercy Crest. We have assisted in independent living, and we have just finished our extended memory care unit. So we will be having our open house tomorrow from 2 to 6 p.m. and everybody's invited to come out. So our phone number is 479-478-3000. Thank you.
from behind. Hey, I'm Sarah with Home Instead. We do in-home care, so we can do cooking, cleaning, laundry, bed changes, personal care, whatever they need. We go into all the facilities pretty much, and we do take them to doctor's appointments, just really whatever they need. So we take VA, Medicaid, and long-term care insurances. A lot of our clients are private pay. And so if y'all have anybody that needs help, I'm at 479-434-6960.
Hello, everybody. My name is Taylor Martinez, and I am with Mercy. So something that I think this group will really be excited about is Mercy is finally launching our 65 Prime Plus clinic, which we're so excited about. So that clinic will be open hopefully October 1. We'll get an invite out to you guys if you would like to tour the space and learn more about it. I have information with me if you would like to chat afterwards, but it'll be located on Mercy Tower West, which is, you know, the old Cooper building if you've been around Fort Smith long enough. It's in the bottom floor. That clinic space is specifically designed for elderly folks. Those exam tables are lower to the ground. They kind of recline back. So hopefully the space lends itself to a really compassionate experience and meeting folks where they are, but also the providers. So providers have a patient panel that's about 1/3 the size of what your normal primary care provider would see. Because of that, it allows us to see patients with acute needs within 1 business day and non-acute needs within a week or 5 days. So you're getting in really quickly, you're getting folks who providers that they need. And then one other thing that I really love about that space is there's a care navigator on site to help make sure that those follow-up appointments, or if there's any additional scans or things like that, they can make sure they're walked through that process in a really detailed way. So I'd love to share more about that. Make sure you guys get an invitation when we're time for a ribbon cutting. And if you have any questions, I would love to answer them and connect with you guys. So thank you.
I know I've never said anything to anybody before, but I'm Sue Lynette. I'm from the VA. I do home-based primary care. We're the ones that come into the home and see the veteran that has primary care. Instead of being able to come to the clinic, we'll come to the home. The provider comes to the home. We have physical therapists that come to the home. We have a psychologist. We have a dietitian and a social worker. So if they're VA connected and they're having difficulty getting to the clinic, you can give me a call anytime and I can see if they qualify for our program. The home has to be safe and within a 50-mile radius of our clinic.
What's that contact?
Huh?
What's that phone number?
Oh, you gotta have
Oh, no.
It is 479-684-9177. Anyone else? No? All right. So, again, we want to say thank you to Dr. Orasakwood and Baptist ER, Wansley, WM Health, and Uncorked for providing everything today, for our speaker, for the location, the awesome food. And so, great job, everybody. I know that everybody's excited about conference coming up. Remember, September 26th and 27th. I'm again going to say the reminders for the things. Assisted Living Week, September 8th. Coffee Talk, September 10th, Mountain Bird. Alzheimer's Walk, September 21st. Senior Care Alliance Conference, September 26th and 27th. So, see you guys there, and everybody just mingle around. Thank you.